Hello, and welcome to Induce With Care, where we explore all things related to labor, birth, and induction. So, I'm your host, Nikki, and today we're going to dive into a topic that more and more mothers are exploring: elective labor induction. You've probably heard of the term elective induction before, but what exactly does it mean? Why would someone choose it, and what are the potential risks and benefits? In this episode, I'll break down everything you need to know about elective induction so that you can feel informed and confident when making your birth plan. So let's start with the basics. What exactly is an elective labor induction? Simply put, it's when labor is intentionally started by medical intervention without medical necessity, typically for convenience or personal reasons. Unlike medically necessary inductions, which are done to prevent complications for the mom or the baby, an elective induction is planned when both the mom and the baby are healthy and there's no immediate medical reason to deliver. The American College of Obstetrician and Gynecologists, otherwise known as ACOG, generally recommends waiting until at least 39 weeks unless there's a medical reason to induce earlier. This gives the baby time to finish developing, particularly their brain and their lungs, which are still growing in those final weeks. Elective inductions are becoming more common, but they still require careful consideration. It's important to have clear understanding of the reasons why you may want an elective induction and to talk to your healthcare provider about whether it's the right option for you. So why would someone want an elective induction? Well, there are several reasons why expecting mothers might consider it. For instance, scheduling and convenience. Life is busy and some prefer the certainty of knowing exactly where labor will start. This can be particularly helpful for those who need to arrange childcare, work around their partner's schedule, or plan for other responsibilities. An elective induction allows for more control over the timing of your birth. Living far away from the hospital. If you live far away from the hospital or a birthing center, an elective induction can provide peace of mind by reducing the stress of rushing to the hospital when labor starts naturally. Scheduling your labor can ensure that you're close to the medical care when you need it. Family or partner availability. If your partner or other family members have limited availability due to work or travel or other commitments, scheduling an induction can ensure that they're present and there when you need them to be. Previous rapid labor. Some mothers have a history of very fast labors, also known as precipitous labors. An elective induction can ensure the mother delivers in a safe, controlled environment, reducing the risk of delivering on the side of a road in the route to the hospital. Anxiety around labor. The uncertainty of when labor will start can create anxiety for some moms, especially if they've had difficult birth experiences before. But elective induction can help reduce this anxiety by offering a clear plan and a timeline. Avoiding going overdue. Many mothers want to avoid going past 40 weeks of pregnancy due to discomfort or tiredness or concerns about potential risks that increase as pregnancy continues. While going slightly overdue is generally safe, some moms prefer to schedule an induction to avoid these scenarios. It's important to note that while there are valid personal reasons for choosing elective induction, it's still always a decision that should be made in partnership with a healthcare provider. They'll assess whether or not it's safe for you and the baby to induce labor without the medical necessity. Now that we've covered some of the reasons why a mother might choose an elective induction, let's talk about how elective inductions are typically performed. And I've discussed these in previous videos, but in case you've missed it, it's pretty much the same methods. Cervical ripening. If your cervix isn't favorable, meaning it's not soft or dilating on its own, your healthcare provider might use a cervical ripening agent like misoprostol or Cervidil, and these medications can help soften and dilate the cervix to prepare for labor. Once your cervix is ready, the provider will likely use Pitocin, which is a synthetic form of oxytocin, to stimulate uterine contractions. Pitocin is administered via IV, and your dosage will be adjusted based on how your body is responding. The Pitocin can help to kickstart contraction and progress labor. Another method that may be used during elective induction is amniotomy, which involves manually breaking the water. This can sometimes help trigger contractions if they haven't started naturally after other induction methods have been used. Foley balloon. If your cervix needs further help dilating, a Foley balloon catheter might be used. This is a small balloon inserted into the cervix and inflated with saline to help widen it. Once your cervix is open to a certain point, the balloon usually falls out and labor can progress naturally on its own or with the help of Pitocin. Your healthcare provider will monitor you and your baby very closely throughout the induction process to ensure everything is going smoothly. It's important to be prepared for a wide range of possibilities. Inductions can sometimes take time or may progress quickly, depending on how your body responds. Now, let's talk about potential risks and benefits of elective induction. Like any medical procedure, there are pros and cons that need to be carefully considered. First, the benefits: predictability. One of the main advantages of elective induction is the ability to plan. Knowing when your labor will start can make it easier to prepare logistically and emotionally, and that reduces anxiety in many mothers. Family support. Scheduling an induction ensures that your support team, whether it's your partner, your family, or your doula, can be present when you need them to be. A lot of people live really far away from their families these days, so knowing when you deliver can help everyone plan to be there. I remember when I was on baby watch for my first baby, my entire family, like my grandparents, my aunt, my uncle, my sister, my nephew, my cousins, they all came to my house and spent the entire weekend with me because my doctor told me that I was going to deliver any day. The whole weekend went by, and on Monday morning, when everyone was leaving and on their way back to work and school, my water broke, and they all missed the birth except for my aunt and my grandmother because they were able to stick around. So having a planned delivery definitely would have come in handy for me. Avoiding post-date complications. If you're approaching 40 to 41 weeks, elective inductions can help to avoid complications that can sometimes arise when going overdue, such as placental deterioration or decreased amniotic fluid. Now for the risks. One of the potential downsides in elective induction is that they may increase the risk of medical interventions such as epidurals, vacuum or forceps-assisted deliveries, and in some cases a C-section. Induced labor can be more intense than natural labor, which can sometimes lead to a higher need for pain relief or other interventions. Failed induction. Sometimes, no matter how much we try, your body just isn't ready for labor and the induction methods won't work. And that's what we call failed induction. And I don't want you to be too discouraged by the term failed. But in these cases, you might need a cesarean section to deliver the baby. It's important to mentally prepare for this possibility. Longer labors. So inductions, especially elective ones, can sometimes lead to a longer labor compared to a spontaneous labor. If the cervix isn't favorable, the process of softening and dilating the cervix can take time, which may extend the labor process by up to several days. Increased risk of infection. When interventions like amniotomy is used, there's a slightly increased risk of infection for both the mom and the baby. Your healthcare provider will discuss these risks with you to make sure you understand them and are comfortable with the decision you made. But it's important to weigh both the risks and the benefits when considering an elective induction. To sum up, elective induction can be a good option for some mothers, especially those looking for more predictability in their birth plan or who have specific logistical or emotional reasons for wanting to schedule their labor. Like any medical procedure, it's important to fully understand the potential risks and to make informed decisions in consultation with your healthcare provider. So if you are considering an elective induction, take the time to ask questions, talk through your options with your provider, and think about what feels right for you and your baby. Birth is unpredictable by nature, but being prepared and making informed choices can help you feel empowered and confident throughout your process. I hope today's episode gave you the information that you need to make an informed decision about elective induction. And as always, if you found this episode helpful, please share it with other moms to be or anyone else who might benefit. Until next time, take care.